What is acupuncture? It's become really popular, yet there's a lot of mystery behind what it is and how it works. As a physician here at Loyola, a medical acupuncturist, I see a lot of patients for pain, and I find that there's a tremendous role for it in that setting. Oftentimes it's chronic low back pain. Other times it's for joints such as the knees and the hips that might be in need of replacing, but patients are not ready for it. There's also pain such as in the nerves from medications like chemotherapy or from diseases like diabetes. We call that neuropathy. So how does acupuncture work? The needle, which is small, fine, and sterile, is inserted into strategic places in the body. And when it enters the body's own natural defense system says, I've just been injured. It will draw on white blood cells to help fight infections. Platelets will come in. Clotting factors will happen so that hole is sealed up, but it also stimulates the body's pain response, right? It says, I've been injured. So endorphins will be triggered as well to help with pain. There is still some mystery behind just how acupuncture works. But the good news is that the National Institute of Health is working actively to clarify, to demystify just exactly what are the attributes of these special acupoints that we use. What makes them so special? Why does it do what it does? While that is happening, if you're interested in acupuncture, please contact Loyola Medicine, where we care for the whole body and we practice integrative medicine.